Hello and welcome to COVID-19 Today. I'm your host for the day, Ben McCain. It's 4 p.m. on Thursday, April 23rd. If you are new to our show, welcome to COVID-19 Today, where we bring you live daily updates on how this global pandemic is impacting our city, our residents, and our businesses here in Torrance. I invite you to email us at COVID-19today at torranceca.gov. That's torranceca.gov. Tell us how you or someone you know is demonstrating how Torrance cares. Well, the confirmed number of cases of the coronavirus in Los Angeles County comes to a total of 17,508, and the new confirmed number of deaths totaling 797. Here in Torrance, the total number of confirmed cases comes to 226. The House of Representatives are expected to pass the nearly $500 billion interim coronavirus bill today. This would help replenish the small business loan program as well as support hospitals and COVID testing. Representative Maxine Waters, who serves the 43rd Congressional District in California, spoke on the House floor today and said that she was dedicating the legislation to her sister who was dying from the coronavirus in St. Louis, Missouri.
This legislation provides $370 billion in funding for small businesses, as well as $100 billion for hospitals and coronavirus testing. I'm pleased that we've been able to set aside $60 billion for our nation's community development financial institutions, minority depository institutions, community banks, credit unions, certified development companies, and micro-lenders to directly lend to their small business customers who are often minority-owned businesses. Small businesses and their workers all across the country are in dire need of assistance and will benefit from this bill.
House members returned to Washington this week to vote on this bill and arrived at the Capitol building today wearing face masks and were instructed to social distance, standing at least 6 feet apart. This package is a fourth in a series of coronavirus relief bills passed through Congress in less than 2 months, totaling $2.7 trillion in federal funds. Well, the Food and Drug Administration announced its first at-home coronavirus test that will be made available to healthcare workers and first responders who may have been exposed to COVID-19. The test is called Pixel. It's a nasal swab kit developed and sold by LabCorp. Users would collect their own sample using a sterile swab provided in the kit and then send it to one of the company's labs for analysis. The kit costs $119, and customers must complete a survey about their eligibility for testing before they're able to even receive one. LabCorp says customers must pay up front for the test, but should contact their insurance provider to determine if their plan will reimburse the cost. LabCorp also stated the home collection kit is only authorized for COVID testing and only for as long as the pandemic lasts. The tests are expected to go on sale to consumers in most states within a few weeks. Governor Gavin Newsom announced the state will need to ramp up its daily testing of COVID-19 by nearly 4 times the current pace in order to modify the stay-at-home orders. The governor says reaching 60 to 80,000 tests per day, along with contact tracing and ensuring those who are symptomatic or high risk are able to access the test, are some of the key factors in reopening California. The state began allowing tests for those who did not have symptoms, who work in healthcare or live or work in high-risk settings. And the County of Los Angeles just announced plans to allow essential workers to test with or without symptoms. The governor also announced California is planning to expand its contact tracing, one of the 6 indicators that he announced that would drive the state's decision to gradually modify portions of the stay-at-home order. Governor Newsom said the state is establishing a contact tracing workforce by surveying counties on their capacities, developing a statewide training academy, and training 10,000 public health connectors to conduct contact tracing. Now, if you're unfamiliar with what contact tracing is, it's a process of identifying people who may have come into contact with an infected person. Trained staff would interview people who have been diagnosed with COVID-19 to figure out who they may have been recently in contact with. Then they tell those people that they may have been exposed and may even give instructions on what to do next. That may include telling them about possible symptoms or directing them to self-isolate. Contact tracing was used during the 2014 Ebola virus outbreak, as well as the 2003 SARS outbreak. It's also used to combat sexually transmitted infections and other communicable diseases like TB. With more people at home under the Safer at Home order, the Los Angeles County Department of Animal Care says they're hoping people will consider fostering or adopting pets during this crisis. Thanks to new funds received, they are waiving fees at all 7 animal care shelters, animal care centers, that is, in hopes of quickly placing them in permanent homes during COVID-19. This is thanks to an $80,000 grant from the Petco Foundation to support life-saving efforts for animals in the county. Here's a view of some of the adorable pets up for adoption right now. Anyone looking to adopt must make an appointment to visit their local center, as they are closed to the public during the health crisis. The closest one to Torrance is the Carson Gardena Animal Care Center on Victoria Street. You can go to animalcare.lacounty.gov. Local organizations that work with City Cable's Canine Corner also said they're looking to help place their foster dogs into permanent homes. You can check out KinmarRescue.org. You can also check out K911resq.com. With the weather heating up today and into the weekend, local law enforcement officials say they plan to increase patrol to ensure visitors are not heading to the beaches or parks prematurely. Residents and visitors are reminded that the City of Torrance Parks and Torrance Beach remain closed until at least May 15th under the Safer at Home order. Local businesses continue to feed our first responders. Momo Paradise in Torrance said they are lowering the cost of their meals for delivery and takeout. And for one of your purchases, the restaurant will donate a meal to Frontline Heroes. They hope to donate at least 600 bowls this month. And Fatburger is taking their burger truck on the road and stopping at various hospitals along the way to feed hospital workers. Today they stopped at Cedars-Sinai Medical Group in Torrance. And the Kiwanis Club of Torrance is continuing their month of giving. Members recently bought pizzas from La Bella Napoli on Crenshaw Boulevard in Torrance to feed the Torrance Fire Prevention Team, as well as city staff working on packaging groceries for the Torrance Cares to Go program. Last week, they purchased pizzas from Lamppost Pizza in Torrance to feed members of the Torrance Police Department. Kiwanis members say these pizza deliveries wouldn't be possible without the community's support. Through the Roots fundraising app, they've been able to raise funds to help their efforts. You can download the Roots app and click on Torrance Kiwanis and donate under Feed Our Heroes. Well, the Torrance Police Department is the latest to light it up in blue to support local men and women fighting on the front lines, as well as hospital workers who face the coronavirus dangers daily. You'll also find all 6 Torrance fire stations lit up, as well as the Torrance Historical Society. And many hotels in Torrance are lighting up in purple to support the hospitality industry as well. Show us how you're lighting up in blue or purple, and we'll be sure to share your picture. Email us at covid19today@torranceca.gov. Well, the City of Torrance successfully kicked off its first week of its new Torrance for Cares Seniors program, offering free in-home COVID-19 testing service to Torrance's most vulnerable and at risk. This program has been well received, and so far 8 seniors have been tested in the homes with results coming back negative. The in-home testing involves 2 trained Torrance fire personnel administering the nasal swab test. Now, don't be alarmed. They do arrive in full personal protective equipment as a necessary precaution. The test should take under 10 minutes, and results should be available in 3 to 4 days following the test. Testing is limited to Torrance residents only who are 65 and older and are experiencing symptoms of COVID-19 or have underlying chronic health problems and are not able to get to a testing site. Appointments are required, and they can be made up to 3 days in advance. The phone lines are open Monday through Friday from 9 a.m. to 4 p.m. You can call this number, 310-320-5918, or go online to the city's temporary website. That's cityoftorrance.ca.com/TC4Seniors. Well, the Torrance Cares to Go program continues to provide an essential service to the community's seniors and those at risk. To date, 1,124 deliveries have been made, and thanks to generous donations from the community, the Cares to Go program has been able to subsidize 205 grocery packages to date to low-income Torrance seniors. Now, to qualify for the Torrance Cares to Go program, You must be 60 years or older, or have a disability, or have underlying health conditions. There are about 18 items in each package, including fresh foods as well as essential sanitary items. To sign up, go to cityoftorranceca.com/TC2Go or call 310-618-6339 Monday through Friday from 9 a.m. until 4 p.m. Well, the Torrance Community Services Department's HIP program continues to help our senior members and those with disabilities receive minor repairs and housework. Now, just in the last few weeks, HIP employees have built a wheelchair ramp for one Torrance resident. That's the video that you're watching right now, and they've added handrails and bathrooms. They also do light plumbing, minor house repairs. They fixed broken windows and doors. They're out daily, and today we wanted to share this photo of Sean and Andres as they visited Mrs. Parks in North Torrance. She hasn't been able to shut her back door since the last heavy rainfall. Well, Sean and Andres added a gutter over her back door to keep the rain from puddling up, and removed and shaved the door seal plate. And just last summer, the guys were out there to paint and add a handrail to Mrs. Parks' home. Thanks to Sean and Andres, who have been working throughout this COVID-19 health crisis, helping to check in on our local seniors. Thanks for all that you guys do. Well, there's a local company in Torrance participating in a national research study to help identify how many have really had the coronavirus in the United States. The National Institute of Health in Bethesda, Maryland, is collecting and analyzing blood samples from as many as 10,000 volunteers. And that's where Torrance comes in. And joining us through video conferencing is the CEO of Torrance, Fasha Mujur, to tell us about what they are doing during this COVID-19 health crisis. Hello, Fasha. Thank you so much for joining us. Tell us how Torrance is partnering with the National Institute of Health in their sero study research.
Correct. Torrance, to be quite honest, is privileged to be providing Mitra at home blood collection kit to NIH for their sero survey. This gives volunteers the option to collect their own microsampling of blood, which is about a drop or two, at home, and send it to NIH laboratory for serology studies of antibodies and immunity.
Now, you had a company here in Torrance that you sold, Phenomenex. How did this new company come about?
Correct. I started my first business, Phenomenex, in 1982, and it started in Torrance, and it was sold in 2015 to Danaher. It started with a one-man band operation, grew to a massive multinational company. And within the company, from 2009 to 2015, a product was being developed, which is a Torrance product of today. And in 2015, we spun that off, and there came about Torrance, which provides this very novel, disruptive technology for microsampling of biological fluid, one of which is obviously blood. Both companies started very small, and Phenomenex is clearly very, very large, and Torrance on its way to be, well, it is already an international company, but still developing and growing.
We keep hearing about this term microsampling. Would you tell us what that means?
That literally means microsample, as in micro or tiny. In case of what our product does, it absorbs a microsample of, let's say, blood, which is about a drop or two of blood, which is taken from a fingertip, and then it's absorbed by our product and then sent to laboratories for testing. And it's done at home or remote places. You don't have to go to a doctor or hospital to give blood.
You have a long history, as you mentioned just a moment ago, a long history of working here in the city of Torrance. How do you think COVID-19 has affected our city, and how will it affect us going forward?
To be quite honest, I think City of Torrance has done a good job. We jumped on this very, very earlier on. The community seemed to have really applied themselves, observing all the precautions necessary, the social distancing of 6 feet, wearing masks, beat the community at large. For me, I sometimes, actually, almost every day I have to go to work and all that. It seems the society, the individuals within our community have really observed and taken to heart all the precautions necessary as it's our duty. I think if that continues, the City of Torrance will see very little COVID-19 infections or Torrance, or we'll see very, very little casualty and all that. I hope our city or the citizens of our city continues to take such precaution to heart and continue doing what they are doing.
What's ahead for Neoterics?
We are really working day and night. Our product, Mitra, was really it had many applications, but our present focus is on the fight against COVID-19, providing NIH and many other governmental institutes in this country and other countries. We're working 16-hour days, 2 shifts, hired a lot of new technicians, developing and producing a product to supply it, all the laboratories that need this to do the studies, to develop the results they need to find, when, let's say, for example, herd community may occur where we can be socially active again and participate in whatever we have to do again. So our main focus right now is on COVID-19 and supplying of meter sampling blood to institutions that desperately need them.
Pasha Majur, thank you so much for joining us and taking time out of your busy schedule, and we wish you the very best with this research.
Thank you very, very much. Thank you.
Well, before we go, at the end of each program, we'd like to share your story of how you and your family and friends and local businesses are all surviving this health crisis. Whether it's something fun to pass the time or something special you're doing in the community or something cool you saw, please tell us about it. Well, thanks to some special friends of Torrance Memorial Medical Center, their campus is looking brighter than ever. Thanks to YMCA LA, who have opened their doors to help medical staff members with child care services. YMCA staff brought some of the children of local medical staff members to the hospital with a mission to decorate their sidewalks with chalk art. From messages of thanks to reminders to wash your hands, these happy messages could be seen all throughout the campus, hopefully bringing joy to all of their workers and patients. What a great way to show how Torrance cares. We love seeing these great photos and videos being sent to us, and please keep them coming so that we can share your story of how Torrance cares. Email us at COVID-19today@torranceca.gov if you have questions or just want to share. And stay informed by signing up at torranceca.gov/Torrance Alerts and subscribe to the city's Facebook page. Well, that's our update for COVID-19 Today. We hope you'll join us again tomorrow at 2 p.m. as Colleen Farrell brings you the latest COVID-19 updates. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.